Members again that all meetings are held in public session, so please switch off your mobile phones or Blackberries as they will interfere with the recording equipment. I have apologies from Roy Beggs, Joanne Dobson and Paula Bradley. All of the members are on other committee business, the ERC and agricultural visits, just for people's information. Members, under chairperson's business, I want first of all to, obviously there has been a number of changes within the structures of the committees and indeed the Assembly, and I want to just thank at this point Mr Jim Wells, who's obviously been elevated to a position as Health Minister. I think it would be appropriate that we acknowledge Jim's role in this committee, and I think it would be appropriate with members' agreement that we wrote as a committee and thanked Jim for his participation over a long period on the committee.
Here.
Members in agreement
Absolutely.
with that. Thank you.
Right.
Also want to advise members that Paula Bradley has now replaced Jim Wells as Deputy Chair of the committee. Also under Chair's business, I want to write to the new Minister to request his assessment of the situation at the Accident and Emergency Department in the Royal on Monday evening. Obviously, this was highlighted on the local media. There was quite a number of concerns around trolley waits and the stresses and strains that were very apparent to not only patients but staff. So I think it would be appropriate that we wrote to the Minister to find out his assessment of what happened on Monday evening and what action he intends to take in and around the issue. Item 3, members, is the draft minutes of the meeting on Wednesday the 17th of September. They're on page 5. Can I ask, are members content with the minutes? Agreed, thank you.
Right.
Item 4 is the October monitoring round. I want to refer members to page 13 of the meeting folder. The relevant papers are there, including a copy of the briefing provided by the Minister when he attended the meeting on the 3rd of September to give a financial update position for 2014-15. Also want to advise members that officials are obviously here today to give evidence on the Department's October monitoring round return. So I want to welcome Julie Thompson and Catherine Daly to the meeting. I'm going to hand over to yourselves, Julie, and we will then open it up to questions from members.
Okay. Can I thank you for the opportunity to provide evidence to the committee today on the Department's financial position for 14-15. And just for clarity, whilst we can discuss the factual position of the DHSSPS budget, given the change of Minister, we will not be able to discuss our approach to October monitoring, as that is obviously a matter that will be subject to the decisions of the new Minister. As outlined in the briefing paper which was sent to the committee on the 29th of April and the previous Minister's letter to the committee of the 28th of August, the Department faces a considerable financial challenge in 14-15. Members will be aware that the Department submitted bids of £160 million in the June monitoring round. However, only £20 million has been set aside and will potentially be provided in October monitoring, subject to the Department demonstrating that it is taking the necessary actions to live within its budget. This means that at best the Department is left with a residual deficit of £140 million to manage in 14-15. Financial deficits are projected in all 5 health and social care trusts due to a range of frontline service pressures. The Department, the Board and the trusts have been working closely to identify opportunities for delivering both cash releasing and productivity improvements, totalling some £170 million in 2014-15. Unfortunately, despite these demanding savings plans, we still have a funding gap of £140 million. The previous Minister's letter to the committee of the 20th of August and the briefing paper of the 17th of September therefore outlined the options that would be feasible at this stage of the financial year to achieve financial balance. As explained at the committee on the 3rd of September, the proposals are not desirable and have significant consequences, but they reflect the factual reality of what could actually be implemented at this stage in the financial year to curtail costs. As I have already indicated, however, the approach to October monitoring will be a matter for consideration by the new Minister, and thus we are not in a position to discuss that with the committee today. In terms of capital expenditure, the constraint is that any bids must be for projects that can be fully spent in 14-15. We have reviewed all our capital expenditure and potential receipts and considered the bids. However, as with revenue, the approach to October monitoring for capital will also be a matter for consideration by the new Minister, and therefore we cannot discuss the bids as they were outlined in the briefing paper to you. In conclusion, the scale of the projected revenue funding deficit in 14-15, even after the delivery of a significant level of savings, clearly indicates that it is not possible to fund a number of critical service pressures from within existing budget allocations. In light of all of these financial pressures, the new Minister will need to decide on the approach to October monitoring, and you'll be aware that discussions are also ongoing at the executive level to seek a resolution to the 14-15 financial pressures. With these caveats in mind, which I'm sure you'll appreciate, we'd be happy to take questions from members on any of the issues raised.
Okay, Julie, thank you. I would like to clarify just a number of points. I appreciate the situation that you're in, and you've made that very clear in relation to the new Minister and priorities and bids going forward. But can I just clarify that what is in front of us today will be submitted in terms of the current expenditure bid?
That will be a matter for discussion with the Minister. What I can clarify in terms of the list of the proposals, those are the factual options that are available to achieve financial balance, and that absolutely does not change. How the Minister then decides to bid into October monitoring is then a matter for himself, and that's where the line effectively gets drawn. So the analysis within the paperwork is absolutely the factual position of £140 million worth of options that could be stopped. Where the new Minister wants to effectively bid and how he wants to bid and the priorities around the bids is a matter for discussion with him.
Okay, so effectively what's in front of us today then, in terms of the 140 million in the paperwork, that these may not become bids?
They are options in order to balance the books. Does Minister wish to take those options? How does he want to bid? What level of bid does he want to make into October monitoring? That's a matter for discussion with him, and there has been no opportunity to obviously have that discussion with him.
But they may not become bids?
We don't know.
Okay. Just from our point of view as a committee, we want to be very clear on that. Because obviously they were submitted to us on the basis that they were bids going forward.
They are the factual representation of the options available to balance the books, and that doesn't change. That's absolutely the reality of the position. What we don't know is then the approach that the new Minister will take based on that analysis as to what he will then bid into the centre.
Just maybe just add on that, just appreciate that may be slightly confusing, but just in terms of where we are with £140 million pressure, and if we weren't getting any additional funding to the department, those are things that currently could be stopped or could be done to basically cover that £140 million pressure. So it's a slightly different presentation. It's not the same presentation as bids, but it's just identifying where we are. The decision will then be up to the Minister as to whether he bids or how he approaches October monitoring, but it'll be in the context that that's what he would have to do to cover the current pressure.
Okay, and I just want to make this point because I think it is important. The paperwork we had previous to a certain time yesterday were bids, but it also referred to in your paper, or a description in your paper, was they were unfunded pressures.
They're unfunded pressures, absolutely, and that's the basis on which they were put forward to the committee, and they're the same figure work. It's all the same as was discussed with the committee on the 3rd of September and provided to the committee previously on the 20th of August, because those are, in essence, the options in order to break even. What we don't know, therefore, is what the new Minister will consider around those, and I guess whether he will be minded to action some of those proposals or whether he will bid for all of those. We simply don't know. But what I can confirm there absolutely was the factual analysis of the options that are available, and we will be discussing each of those with the new Minister and identifying whether he wants to take them forward as bids or not. And that's unfortunately all we can say at this point.
Were they bids yesterday?
They were unfunded pressures yesterday.
No, it's not this.
No, it's not.
Well, I'm not clear because we received this paperwork saying this was the bid for the October monitoring round. Will the committee please support this?
In terms of where we were yesterday, those were the unfunded pressures as identified, and working then through with the previous minister around the strategy for October monitoring, that was all still in play as well. So that doesn't, if you like, move the committee on. Where we are is this is the list that will go to the new minister, and he will need to consider what to do with that list, whether to bid, whether to action, and how to deal with that. And meantime, as I say, discussions are also ongoing with the executive around this space as well. So it's an exceptionally fluid position for all sorts of reasons.
It's very unclear. Just moving on, you're making great emphasis around the minister's priorities. And can I maybe just clarify again? In June, we had the bid, the monitoring, for 160 million, and much conversation and speculation around that. And there was the allocation of 20 million. What has that 20 million been allocated to?
We haven't actually received that 20 million. The 20 million was conditional. And is not yet received, and is still wrapped up within the decisions around October monitoring. So we haven't received the 20 million
Well,
as
what
of yet.
will it be spent on?
In terms of, again, it'll be a matter for the new minister, but expenditure, as you know, has continued to be incurred right the way through from the start of the year. So against a lot of those areas that we bid for, expenditure has already been incurred on that, but the actual split of that will be a matter for the new minister, because we haven't actually received the money yet.
Okay, but with respect, there must have been a pecking order for that 20 million when it was conditionally allocated,
Well, in terms
from the
of
department's perspective.
well, no, that is ultimately a decision for the minister. And in terms of where the spend has been continues to be incurred in safety. And you look at the bids that we made in June monitoring, in virtually every area, spend has continued to be incurred. Where the minister wants to assign that 20 million, assuming we do get it, will be a matter for him.
Okay, I want to move it on to the bid that's in front of us today, which has now been called unfunded pressures. But if you were to receive an additional 140 million, again, what would the priorities be in terms of spend?
I'm afraid I can't answer that. We need to go through this list with the new minister and identify where his priorities lie, and there has been no opportunity to do that. So we need to basically work down that list with him.
Well, can I ask you then, in light of that, and we've just come from a training session around the monitoring bids, and there is a clear requirement across all departments to provide committees with the list of their bids in terms of what they're asking for, the allocation and priority and impact. What we have in front of us today, yet again, doesn't give us any indication of what the priorities would be. And I would suggest that all of us would want to find all of that money to deliver for health. But I think there's a stark reality there as well in relation to what can be allocated. And it's not clear from any of that paperwork or any previous paperwork what the department's priorities are in going forward. What will be A, B or C?
Again, I completely accept that, and when we submit the information to DFP, which is due by next Thursday, absolutely it will have to have a prioritisation with it and with the analysis that you've discussed. But we haven't got that at this stage because we need to go through it with the new minister. So it will be worked up with him. We're having that conversation, starting that conversation tomorrow with him, and we will be working up in the next week exactly what you are suggesting we require, because we do need to put that into DFP next Thursday.
Okay, just two quick comments. Are you confident that in terms of this approach, or your approach to managing the department's budget, that it is in line with DFP guidance?
When we submit the October monitoring terms, and we will obviously copy those to yourselves as we routinely do, they will be in line with the DFP guidance. They will set out the rationale for the bid, they will set out the impact of it not being funded, they will set out the amount, they will set out the prioritisation. That will all be within the October monitoring submission to DFP and has to be done by next Thursday.
Well, can I ask, why were they not done in that format for today's meeting?
They were not done in that format for today's meeting because at the time we had unfunded pressures. There was numerous conversations still ongoing with the executive, and that work was still to be put forward and through. And that work was all timetabled to be put through. There's a meeting of the executive tomorrow, which could change things as well, and that's where we are at this point in time.
But I think, Julie, the previous monitoring round was a similar discussion, and the one before that. Because the previous monitoring round, if you remember the conversation around the committee were pushing to get the list of priorities, and we got A, B and C.
You did.
So we haven't been given to date at any stage the proper format in terms of requirements that are in DFP guidance.
With respect, we've had nothing of that nature fed back to us from DFP. The stuff that was given to them in June has the prioritisation with it and has all the detail in the format that they require. And there has been nothing said back to us as a department from DFP officials that we have not submitted the right
That wasn't
material.
shared with the committee.
It was shared with the committee, absolutely it was.
Not in the format that we've seen under DFP guidelines today, it wasn't. And it wasn't shared with the committee today.
Well, we can certainly have a look about what I'm obviously not familiar exactly with what you've been told, but all I know is from DFP officials that there was no feedback given back to us in June that what we had done was incorrect. Happy to look at that and have.
But I mean, and this is an important point. This is a conversation that has taken place at every time the department has been in front of this committee in relation to the monitoring rounds, where we've continuously asked. We have a limited pot, if you like, there. What are the priorities? And, you know, we now discover that there is a format that should be used and adhered to that hasn't been. So we effectively today, regardless of the changeover of minister, but today we were being asked to sign off on 140 million with very basic information. Very basic information. We're not told in any of that paperwork. In fact, that is the previous monitoring round copied. And we're not told in that paperwork what is priority A, B or C. What are the things that the department has to do in order to most protect the delivery of our service?
I absolutely appreciate that, and certainly I would fully accept that the paper that you've got now is not in the right format for DFP. What I'm saying is the one that was done in June absolutely was in the right format, and we've had no indication from DFP officials that that was incorrect. I appreciate absolutely we've had previous conversations with the committee, and I think for the last 2 monitoring rounds, if not more than that, we've then been copying you the full detail of our bids through at the committee's request, and that has been worked through. So the material that was given in June was the full bids that we gave to DFP, and for which we've had no comment or problem with it. In terms of the material today, I fully accept that that's not in the bid format, and we need to work with the new minister to get it into the bid format over the next week. The timing of this has been exceptionally complex, and given that discussions are ongoing at the executive on a day and daily basis, what was going to happen by now has already could have changed fundamentally where we are at, and we are where we are at today, which with £140 million shortfall, and we need to discuss the priorities with the new minister as to how much does he want to bid for, and where does he want to place those priorities. And around all of that, unfortunately, we know that we cannot discuss that with the committee today. That's just the reality of where we are.
Well, is that good financial management?
Well, in terms of the reality of, we know absolutely the 140 million of options that could be actioned in order to bring back to financial balance. Those have been known and been set out to the committee and to the executive in August. Those don't change, and that is the plan, if you like, that would have to be actioned in order to come back to break even. And we've worked on that as soon as we were aware that the June monitoring position was one that was going to prove very difficult for us. So absolutely that has been done. What I can't answer for you is what the Minister then wants to do with that information and where he wants to place his priorities as we move ahead.
Okay, so you've accepted that we haven't today received the correct format in terms of what would be required going forward for DFP?
Absolutely, yes.
So we haven't received the correct format, so were you intending to come back to us next week?
We were intending, and certainly would have copied to the committee the detail. I would have talked more about priorities and what that looked like, and I can't do that bit because of what's happened. So that's the bit where we could have probably had a further conversation about it. We offered whether you wanted to have this session today or not, given the circumstances in which we're in, and that was offered this morning. So, but in terms of the priorities, I don't have any authority to talk about priorities because there hasn't been a conversation with the new Minister about them.
Okay, because there's a number of members have obviously indicated this, and I just want one final question in relation to the bids or unfunded pressures that they're now being called. The department was given permission, or it's in relation to the bad enemy, this request to retain the 2.4 million receipt for the radiotherapy unit in the North West. There was obviously a debate in the Assembly last week on that. Do you or can the department guarantee that if that money is returned, that it would actually be used for that project, or would it be transferred to another project?
That's a receipt that is related absolutely to Altnagelvin and was expected to will fund the Altnagelvin project, but we have to go through a process of bidding for it in order to get it back into our budget.
But if it was back in the budget, would it be specifically for the Altnagelvin project?
As I understand it, the money would be assigned to Altnagelvin. Yeah.
I suppose the funding is being made available in full for Altnagelvin, reflecting the full cost, which would include that. But the point is, there's that technical process to go through, so it'll be funded, come into the department. If it's already been funded, then it'll be used to whatever was offset to fund it. So it's really a timing thing, but the Altnagelvin project will be properly funded.
Accept that it's a technicality. I do accept that, and the request has to go forward. But I just want to be very clear that if that is agreed, that it wouldn't go to another project.
No, the funding that Altnagelvin needs to be built will be coming from there. Absolutely.
Okay. Thank you for that. I have Kieran next.
Thanks, Chair. I just want to support your exasperation, and we're not able to discuss what you people are here to discuss. Now, that's not our fault, probably not your fault, but I mean, I am suspicious of how the whole thing was handled. Is this a case of the Minister that has just left his post throwing up the arms and saying, I'm not getting 140 million, I'm not going to go through with these cuts, and therefore we had the crisis on top of crisis? Is this where we're at today? I mean, you're given no information. We've spent the last 20 minutes, you defending yourself, not being able to explain to us the October money run. What's happening? What's going on?
In terms of the 140, that is the financial pressure that we're currently experiencing. The list that's in the paperwork is the list of options in order to bring back to financial balance, and we need to discuss with the new Minister how he therefore wants to approach October monitoring. In relation to those, does he want to bid for the funds? Does he want to action some of them? Does he want to bid for all of them? All of which have to be discussed with him.
Can I, Chair, talk about the Minister that has just left, because he had quite clearly had a request for 160 million. He got 20 million, of which he hasn't got yet. So we're still left with 140 million. And the last time you people were here, you said that if we didn't get the 160 million, our patients would suffer, our waiting lists would go on. Well, that's exactly what's happening, and it's going to happen even longer because there's a new Minister. That can't be good for patients, our constituents, or anyone. Now, there was talk of an 80 million gap to the outgoing Minister. Where did that go to? Where's that at?
In terms
is that why he's out? He's left? Couldn't get the money that. Well, I mean, this is true. There was a talk of 80 million to plug that gap. Now that's gone to the ether somewhere. The Minister's gone. What's happening?
In terms of the overarching position, there are discussions ongoing at the Executive, and those discussions have yet to reach resolution on whether any funding would be found or not for health and what the impact on other departments would be. And the reality of that is that conversation is expected to continue again at the Executive tomorrow. And we don't know what the outcome of that will be. I would concur completely that uncertainty is a problem at the minute, as is the fact that as expenditure continues to be incurred, it gets harder and harder to pull back into financial balance. So we all need, I think, clarity about what the budget will be, and therefore can take whatever actions are necessary with the decisions of the Minister around that. So that's where we are at the moment, and that's all, I think, all I can say on that.
And in the meantime, transforming your care goes on apace. I think there's a request, well, there was, and certainly in the last June monitoring round, for 23 million. Was that full? Yeah. No, it wasn't, because you're still looking for the 140 million, but still the transforming your care goes on.
Yes, as with all aspects of health and social care services are continuing. Clearly, we have a very serious problem in terms of the financial deficit, but we do have a £4.5 billion budget, and so clearly there are major services continuing to be developed, and elements of transforming your care are continuing to be progressed. But as was clear from the outset, there was a total of £70 million indicated that would be required across the life of transforming your care to transition costs for implementation. And clearly, where there's a shortfall in that and pressures have identified, that will have an impact on those elements of work, but not all elements of transforming your care. So, and as Julia said, you know, this paper shows the unfunded pressures, and if you looked at this against the figures that were bids in June, some of this has changed, and that is a reflection of the fact that services are continuing to be delivered, and some of this figures are changing because we do have to continue. The brakes have not been put on, but clearly as time progresses that becomes more difficult.
Yeah. And just finally, Chair, I mean, there are so many people that will suffer as a result of this. Is it a case of Simon Hamilton, the Finance Minister, was right in that there was the health budget had been mismanaged through the last period of time?
In terms of the comments of the Finance Minister, they were in relation to the £13 million overspend in 13-14. And Minister discussed that with the committee when he was here on the 3rd of September about that. So the actual, that was the reference that the Finance Minister was making, was to the £13 million of last year. We obviously need to find a solution in 14-15, and that is not available as of yet.
And in the meantime, until this 140 million gap is funded, our patients, our constituents, will be at risk of less domiciliary care, less elective care, etc., etc., etc. So we are in real, as the Chairman said, a real mess at this time. And as long as the delay goes on, we're letting our line into a bigger mess.
When, if this 140 million of proposals had to be actioned, absolutely there would be significant and severe consequences.
Can I just on that before I bring the next figure on? There was indication then that between the figure of 80 million and 60 million would be required to get through some of the pressures. What would that have been spent for?
Again, that was conversations that were ongoing, and a discussion that will have to be had with the new minister.
Okay. Gordon's next.
Thanks, Chair, and thanks very much, ladies, for coming in this afternoon. The two appendix documents 1 and 2 that you provided, we understand from your last presentation that those were drawn up after careful consideration by officials within the department. Are they in priority, in the various priority lists? Is that drafted up in need or against any real priorities?
No, there's simply a factual analysis of looking across the entire budget. They're in two categories, because the first category is about where you can potentially take additional savings, or where pay restraints could be employed. The second list is then about looking at service developments. And where we have not yet committed funds, then there is an option, obviously, to not commit those funds and therefore get back to financial balance. So that both the two lists are there. They are from looking across the entire budget, and a lot of detailed work absolutely went into generating those lists to identify all the uncommitted funds. You can't look at committed funds because the expenditure has already been incurred, where staff are in post or legal commitments are already in play, and therefore we've looked at where money is uncommitted, and that's what the list represents as at that point, but they are not in any priority order, no.
They're not. What advice would you be given to the Minister Jim say tomorrow in relation to priorities?
I guess in terms of that, the issues around how do you maintain service provision, protect patient flow, ensure that EDs have the capacity to manage. Those are where if you constrain or restrict expenditure in those areas, and even in the likes of domiciliary care, which would also help to maintain patient flow, those sort of areas, if you cut them back, will have severe consequences in terms of the hospital system and its ability to cope, particularly in the winter period. But equally, you can have a similar discussion about the importance of nice drugs, the importance of TYC, and the importance of elective care. Every single thing on the list is things that effectively should happen, but and it's that type of discussion with the new minister about where he would therefore see the priorities within these particular lists. But there is no doubt that whereby, for example, the discussions the last time around locum doctors or agency nurses, any of those proposals would have very significant consequences in the ability of the hospital system to manage through winter period. And that's the type of conversation that will need to be.
Yeah, I think in that context, certainly, looking across all of this, you'll see any issues in relation to patient safety would be a key issue in terms of what the impact is there. So that would be a key element of consideration.
Okay. We've had various figures. The 20 million, I understand, is likely to be provided. Is that fair?
20 million has been set aside for us, but is dependent on the final decisions of October monitoring, which has not been decided yet.
Then there is talk of an additional 60 million, bringing it up.
There's an unofficial number of that nature, but there is no official executive paper to that at this stage.
If you were to get 100 million in total, could we live and retain our services to reasonable standards, to existing standards across the organisation?
I think the issues around certainly would it avoid the worst of the consequences. That would be the case. But it's a judgment call about how far along the spectrum. Obviously, the more money that we would receive, the fewer consequences there would be. But you would be right that if we got 100, at least the worst of that could be avoided. But we would have to work then with the new minister around what he would be prepared to effectively action and where the money of the 100 would go to. And that's not an easy conversation, because every single one of these are compelling issues in terms of where money might go.
The ED problem continues to be a continuous draw on resources. It seems to be a bottomless pit. And do you see where we will get to the stage where it will be manageable, where it will not be the continuous draw? And it seems to be the priority, and it's the one that the media focus on. It's the one that has a major impact on all of us that are involved in the health sector. How do we address that without continuously pay out?
Well, sorry. Clearly, that has been a major focus in terms of priority for the department, and members will be aware of the RQIA inspection report for the Belfast Trust at the beginning of this year, and then the further RQIA report in the Belfast Trust and looking at regional elements in terms of unscheduled care, and that the previous minister established an unscheduled care task group, which is chaired by the Chief Medical Officer and the Chief Nursing Officer, and involves the Chief Executives of all the Health and Social Care Trusts to look specifically at unscheduled care going forward. Now, clearly, within the unfunded pressures paper here, you see that there are funding pressures. There will be year on year within emergency departments, and clearly there is funding that will be required to address the winter pressures and ED capacity issues going forward. But the reality is, a lot of this is the manifestation of the changes that have been talked about in terms of demographic change, the increased prevalence of long-term conditions. This has been felt across all parts of the health and social care services. The emergency departments are under pressure, and work is being taken to try to address those issues. Certainly, there has been improvement on the extent of 12-hour breaches if we go back to this time last year.
Yep.
but clearly an awful lot of work is still required to be there, and there's a great emphasis on that. But if, you know, as you go through each element of this paper, you'll see all the various elements that link to that. It's not an emergency department problem on its own. If you look at discharges and the rates of discharges, and then the domiciliary care packages, the care in the community, it's all linked. So the whole system has to work together to ensure that those problems are effectively addressed. And I think that's one of the things that, you know, I appreciate the frustration for the committee that we can't prioritise this in terms of what we're talking to you about today. But as you look through this, there isn't a single element that isn't really related to other parts of it, and it's all inescapable, really.
The two issues, elective care obviously affects a lot of people, and the other thing is the prevention programmes that, you know, the previous minister was very keen on, and I think we're all very supportive of that prevention programmes, because effectively it saves money and keeps people in good health. How would you see those within your brief to the minister? Those issues, elective care and preventative programmes, would you see those as being something you'd speak up about?
Well, absolutely. They are part of the unfunded pressures in terms of elective care. There are two issues there in terms of the demand capacity across the service and the gap between demand and capacity and ability to deliver on that. There are pressures on elective care, and in terms of the unfunded pressure, I mean, the extent of the gap between demand and capacity is significant, but a lot of that will be addressed by the Health and Social Care Board within its own resources. But in terms of the unfunded pressure there, waiting lists across a whole range of specialties, the numbers on waiting lists in excess of 9 weeks will increase by around 20,000 for assessments, and on day case and inpatient treatments, the waiting list would be expected to be increased by more than 7,000. It's just over 7,000. So, you know, the waiting list position is currently not good. Waiting lists have been increasing over recent months. They had been improving between March 12 and March 13, but more recent figures show an increase in waiting lists. And in terms of this pressure, if it's not funded, those waiting lists will increase.
We really need that 21 million.
It is
very much a priority, really.
Yeah.
Mm-hmm. Thanks very much, ladies. Thanks, Chair.
Thank you, Gordon. I have David next.
Thanks very much, Chair. I wonder if I could maybe just for a moment move us away from ministerial decision to departmental responsibility, because I think there has been a little bit of possible deviance from that today. Almost 2 years ago, the department were in court with the Board of Community Pharmacy, Northern Ireland. The department lost. The outcome of that was that there was to be an interim payment of, I think, around about £6 million made, and then a cost of services and needs assessment would be carried out. Now, to the best of my knowledge, not one penny, that £6 million, has been forthcoming to community pharmacy. And I'm also led to believe that the needs assessment and the cost of services survey has also been fairly light in content so far. So what I wanted to try and get some understanding of is, I've checked the monitoring rounds for the last 3, and I haven't even seen any bids for this sum of money. I suppose, I mean, not to be too harsh, but effectively by not doing so, the department are putting, I think in particular, the business services organisation in a position where they are effectively in contempt of court. So how is this issue going to be addressed?
In terms of, you're quite right, that court decision was around, I think, December 2012. And finances there was an interim agreement at that time with money provided to community pharmacy for 11-12 and 12-13. Since that time, we've been working both on the margin survey and the COSI survey. On both of those progress has been certainly made on the margins. I can't remember exactly which year that they've got to, but they are working through the years in discussion with CPNI and liaison with them. On the COSI survey, the latest position on that is that has been moved to be now carried out through the department under the auspices of CPD, and the tenders for that will issue in the next few weeks, which will kick that process off. And that has been discussed and agreed as an approach again with CPNI. So we're working very closely with them, and there's ongoing discussions with them in terms of where we are at. The financing then of any further money to CPNI is wrapped up. You're quite right in the outworkings, effectively, of those two key pieces of investigations, and that's what we're waiting to work our way through. So it's likely to be in and around. I think that it's around sort of springtime next year before those particular investigations will be fully worked through. But certainly the close liaison is ongoing with CPNI about that as an ongoing basis.
Thanks for that, Julie. I suppose where I remain a little bit unclear, I mean, an interim payment by definition is interim, and what you're telling me is that the payment will come after the COSI is done?
Because it's dependent, the two investigations effectively will help inform what payment is needed.
But the judge already decided that with respect.
Well, the judge was about how we can, was about process effectively, about how we needed to, and that this was absolutely required to move the position forward. That's the piece of work that we're actually working through. And as part of the good faith effectively around that, then interim payments were made for 11, 12 and 12, 13. And that's where it sits at this point in time. But certainly there has been ongoing discussion with CPNI about all of this and about moving those investigations forward. And the current approach with the COSI analysis and the tenders coming through under the auspices of the department, it's literally within the tenders are drawn up and they're nearly ready to go. So we are making progress. It's maybe not as quick as CPNI would have liked, but that it's within touching distance of getting that work fully away and with it to report through into next year.
So when is 13-14 expected then to be paid?
I'm not aware of. We have to work through the processes, is my understanding of that.
Because obviously, I mean, the industry feels, on the basis of the judgment of 2012, that they're entitled to that. So, if that is not forthcoming, presumably there is a considerable risk that it will go back to court.
Well, we need to work through, and certainly we would intend to work through with CPNI, that these are the key processes that need to be done in order to decide the remuneration levels for community pharmacy, and that's what we're intent on working through, and discussions are ongoing about that. That's about as far as I think I can take the conversation today, but we are certainly keen to work with CPNI and get those processes finished off as quickly as possible.
Okay, thank you. Thanks, Chair.
Thank you, David. Fergal.
Thanks, Chair. Can I just clear up the status of this? Is this a bid?
At this point in time, no.
Would it have been a bid today if the Minister hadn't changed?
In terms of whether these are lists of unfunded pressures, and that would have been a matter for the previous Minister in light of very, very ongoing and very fluid executive conversations. That's the issue that's also causing confusion, I think, within this.
No, but I think there's a bit more confusion. It's not a bid, and it is a bid, and it isn't a bid. You know that. It's not quite clear, Julie.
We need to be absolutely clear for any avoidance of doubt. The paper you have in front of you is not a bid and wasn't presented as a bid. When it was presented, there were capital bids in it, but schedules of unfunded pressures. And we were very clear then, in light of the developments yesterday, that it wouldn't be possible to talk to the committee today about bids. But the paper that you got was not a bid, other than the capital bids.
But we were, if you like, under pressure, both privately and publicly, as I say, in this committee and externally, if you like, around the need to back this, otherwise all would collapse.
Certainly in terms of the unfunded pressures, they are absolutely the factual analysis of the unfunded pressures. In terms of then turning those into bids and the extent to which, out of that 140, how much do you bid for? Do you bid for the whole 140 or an element of? That's where the conversation, if you like, has got to, and that's where we need to have that conversation with the new Minister.
So what's the margin then between what is a bid and what you could conceivably live with?
Well, ultimately, I guess it's back to the conversation with Gordon around. It depends on where the new Minister wishes to draw the line on that, because every single one of these, you can create a case about why they should be funded and the difficulties that are presented if they are not funded. But the new Minister may take a view as to, well, I will bid for these and not for these, and we will, see where we go with them and whether we action them or whatever. So that's the reality of the position that we currently find ourselves in.
Some people may say, I mean, you're doing your job. You're looking after the books, and you need to make sure that you get as much money as possible. Would that be right?
Absolutely.
So you would allow us some scepticism over those figures?
The committee is entitled to challenge them, absolutely.
Absolutely. So how did you arrive at them?
So much better now.
In terms of 140, what we did was look at, and I guess this applies to the budgets generally, what we look at is all the pressures that are presenting across the service from both existing service provision and where the costs may be increased on those, and then for new and expected service developments are all worked through. You then analyse what you can bring to the table effectively to fund against that. Obviously the executive original budget allocation is in there, alongside then the savings that trusts and the rest of the system can bring in, and the net result of that was the 160 analysis that formed the original bid. The moving on then to this analysis is to say, well, if we assume that we will get that 20, we're 140 short. Then what do you do? What we've had to do at that point is to say, right, the only things you can do at this point are the things that you can effectively stop that are uncommitted, and that's where the flip comes between the bids as they originally were and where we are currently now, because at that point you're only interested in things that are options to break even, and that's the very financial analysis that goes behind it.
Yeah. So you're trying to do your job, maximise your pot, and you write to the trusts and you ask them, can you tell us how bad your situation is? Mm-hmm. So they're going to maximise their pressures, one guesses.
Well, in that
they're doing their job.
Well, I would suggest that they should be giving us a realistic assessment of pressures and a realistic assessment of what can be achieved. And you are absolutely looking at those numbers and identifying whether more can be brought to bear on them. If you look at then last sort of September, October time, where the deficits of the trusts significantly increased, that's where absolutely the approach that you're talking about in terms of saying, well, what more can be done? Can you do a bit more? What more can you bring? What have you not looked at? Where, what extra can be brought into that? And are those pressures really there? Which is then around the demand side of the picture, and where actually, effectively increasing population needs have come into play. So you're having that conversation on an ongoing basis. The trusts, initially through the HSCB and then through to ourselves.
Yeah. But I suppose the picture I'm trying to paint here actually is that there's room within this for people to make it a bit blacker than what it is. At least given the context that you want to do your job and they want to do theirs.
In the sense that we challenge them and that we look to identify that they have done all that they can. And as we talked at the committee before, the numbers are not changing. They're not going away. If anything, they are increasing in terms of pressures out there. So, absolutely, I need to do my job and not take for granted what somebody gives me in terms of a deficit and say, well, we'll just add that onto the pot. So you're looking to see what is happening on the ground, and every finance director right across the system has to do that. Every finance director has to then ensure that they are reporting to their accountable officer about what that financial position is, and then working with the teams around both managing pressures and about bringing savings into play. Every single organisation is doing that, and then back through and up to ourselves. And I know certainly when you look at the figure work of where we're at, the the history of where the department has been is to have very, very small underspend, and yes, last year a very small overspend, but the numbers have stuck around where we have expected them to be.
So if we were to drill into this further at some stage, you'll be able to point to really good, deep interrogative work between the trusts and yourself about narrowing those figures down.
You will see certainly that we have asked them for further savings. We've asked them for contingency plans. We've asked them for what their monitoring arrangements are. We've got monthly. There's a series of things that are informing that. Predominantly, as I say, between the trust and the board in the first instance, and then between the board and the department. And that's all about understanding where people are at and ensuring that the numbers are hammered down.
So maybe we could turn to one specific figure, and that is around bank and agency. How much across all of your outlets, if that's the right word, is spent annually on bank and agency?
The figure what we had for 13-14 was in the order of about 50 million. And in terms of what we then had, now that was the 13-14 number. In terms of then the figure work that was in this analysis, it would work back to an annual figure of 30 million in terms of 7.5 million. For 50% of the year, for 50% of the cost, we'll multiply you back up to 30. Why we haven't gone with the full 50 is because in the meantime normative nursing has been brought in, and that's about deliberately bringing in permanent posts and staffing up wards to the normative nursing levels, which was always expected to, if you like, reduce agency and bank spend. So rather than stick with last year's, we've brought an element of conservatism to that. If you could, what the proposal on here is that 7.5 million. If that could be delivered with less than a 50% reduction in agency and bank, that would be fantastic. But at the end of the day, that particular proposal is an exceptionally damaging one and has I would suggest is something that you would do as an absolute matter of last resort. We know all the trusts have identified it as an option within their contingency plans, although they've taken slightly different approaches to it. So we've sat above that and tried to take an analysis of what that would mean, and it's mathematically driven off a £30 million agency and bank nurse spend, because we know that as a minimum we would be spending that level in 14-15.
Yeah. But is there a common pattern of bank and agency staff? Because I think there are some figures out there that suggest that in June alone, the Western Trust spent just under 6 million on bank and agency.
The Western Trust spent about 750,000 in the agency and bank in 1 month. I'm not sure where the 6 million comes from, but the number that they've given us is 750,000 for a month.
Well, I'm sitting with figures in front of me of 6 million.
Well, we can share afterwards.
So, in terms then of pharmacy, how advanced has your review work been on savings there?
In terms of pharmacy, it is an area that we have been looking at over the last series of years. We have taken out in family health services and FHS 117 million in the period 11-12 to 13-14, with another 25 million to be targeted in this particular financial year. So it's an area that we are continually looking at and continually looking to improve. Our prescribing and generic prescribing and dispensing has been increasing as percentages. Is there more to be done? Yes. Will we do more? Yes. And 25 million has to come out in 14-15, and so it is contributing, if you like, on an ongoing basis to the figure work around our savings. But there will be more that needs to be done.
And the central plan TYC, how much of the money that you're bidding for is going to board wages, TYC board wages?
How much of it is for?
How much of the money that you're bidding for actually goes to wages of those employed doing TYC work at a board level?
Sorry, Fergus, when you said board level?
Or yes, there's a TYC board. Yeah.
Sorry, I don't have the detail of TYC broken down to that level. That's something I would have to come back to, and we've got details of what spend has been to date, but I don't have it broken down to that level, but we can provide that to you.
Mm-hmm. I've seen a figure, you see, in a chart which says that there's no wages associated with the TYC board.
And sorry, can I ask?
That's what I'd like to know. Are the TYC board being paid out of the money you're bidding for?
Oh, the
Or is it being paid out of elsewhere?
So that's why I wasn't clear what you meant by the TYC board. There's the Transformation Programme Board within the Health and Social Care Board. Is that the board you're referring to?
Well, we can play with terms. Who
But-
runs the
but-
TYC
but
plan,
the-
and how are
but-
they getting paid? And are they getting paid out of this bid, or are they getting paid out of somewhere else?
HSCB is responsible for taking forward the vast majority of the implementation of proposals under TYC. They have a Transformation Programme Board which is staffed by HSCB staff whose costs would not be reflected in the TYC bids. They would be part of the HSCB staff
Are you
costs.
saying that all monies that are bid for in the round are going to projects and development
And with-
TYC work?
There's an
and
element-
not
And
anything
within
else?
that, there would be staff costs because
How
there are
much?
staff.
Well, that was my first
Sorry,
question.
Yeah, sorry, no, but right
Is
across.
it entirety or is it partial?
No, it's not. It's not entirety, but it would probably be a significant proportion because in terms of the ICPs and taking forward the ICPs work, it's staff resources largely that will be driving that work forward. It's staff who will be developing care pathways. You know, a lot of that is staff driven, so we can certainly get the detail of that, but I don't have it broken down that level. But certainly across the implementation programme, or the ICPs, the service changes, there would be significant staff costs within it because of the staff that are required to actually deliver it.
And just finally for me, in terms of domiciliary care, and I know this might reflect the pressures, but is there a danger that you'll fall below your legal requirement in the sense of provision? And could you find yourself otherwise on the wrong side of issues, if you like, if you drop below certain timescales, and maybe potentially health and safety issues or whatever that might emerge as a result of that?
And I think that's something that absolutely can't happen, in the sense that the safety of whether it be a domiciliary care client or anybody else across the system has to be priority, and that's very much at the heart of where everything is. So there's a minimum. You can assess need, and that's all. You can do that, and you can assess it against the different standards, and say that you're only going to produce packages or provide packages over a certain level. But at the end of the day, the safety of domiciliary care clients will have to be given primacy. And as Catherine's already said, safety would be one of the things that is at the heart of, if additional money is found, you would want to put it in places where safety is protected and maximised.
And just one of the members was asking earlier about our advice to the Minister, and obviously that's privy to the Minister, but in terms of prioritisation, when we're looking at advising the Minister, if there are statutory obligations that are required to be delivered in any of those areas, then that is something we would be certainly highlighting, that statutory requirement.
And can you give us a guarantee that you haven't fallen below that threshold as it is?
That's the responsibility of the Trust to ensure that they are of the duty of care, and they need to ensure that when they're providing their services that they're doing it within that duty.
And as you look at it, and as your responsibility for the Trust, can you guarantee us that the Trusts are providing that level of care as it is? Given the pressures that we hear, the fact that there's 15-minute care packages, the fact that we hear those who are providing them can't get adequate travel time to and from individuals who are receiving that care, can you give us a guarantee today that those trusts are in line with their obligations?
What we do is hold the organisations to account for a wide range of issues, one of which is quality and safety, and certainly would be ensuring that they are taking the necessary steps to provide that safe and quality care, along with that they're meeting performance targets and finance and whatever. It's difficult to give a full, cast iron guarantee that everything out there is being done within that. That's the responsibility of the Trust, and we are holding them to account for the delivery of that. But that's our responsibility, and I fully accept that.
More than a tad worrying, though, that I'm not hearing a resounding yes.
I have no reason to believe that it isn't, but I can't. It's.
No, I mean, I understand, your point in terms of the resounding yes, but I understand also what Julie's saying. In terms of the systems and process we have set up, we would expect that through the accountability framework, if there were any issues with that we in the department should be aware of that. And I'm not aware of any issues where there has been a breach in that respect. We absolutely would expect that would be fed to us through the Trust and the board, the HSC board.
Okay, thank you, Chair.
Thank you, Fergal. Mickey?
Yeah, thanks very much for the presentation. And I know you are faced with a new regime there at the SCOTUS finally arrived for Jim. And obviously I think in the circumstances you've been very politic with your answers. You've said quite a lot and told us very little, but no real reflection on the situation that you're faced with. Just on the priorities, because obviously you said that you're going to have to talk to the new minister about his priorities. In your experience, and is there likely to be a divergence in his priorities, and possibly what you might be pointing out what you think their priorities are?
I don't think I can comment to that. I don't know. We need to have the conversation.
It was a rhetorical question, really. No, just because presumably there are priorities that are there, and it would seem strange if you were talking to the minister about priorities and there was a divergence there, that that those priorities may not actually.
Well, we have no reason to believe that there will be a divergence, if that's the question. I think the real issue is that every single one of these is viewed as important, and I guess that's the conversation we've had at the committee as well, because how do you prioritise these when they are all so compelling in their own right? And that's a difficult thing for us to answer, because it ultimately will be decided by the minister.
But ultimately, somebody has to prioritise.
Yes, and he will have to do so.
You will be advising him wisely, I'm sure. That's fine, thank you.
Okay, thank you. Okay, well, just by way of conclusion, I mean, I'm certainly not satisfied with what we've heard today, and suggest that we wouldn't be in a position to move forward in terms of the information that we've been given. And I do think it needs to be said around the issue of whether this is a bid or not a bid. And I do quote, Julie, from your own briefing paper to the committee for today. Point 10 on the briefing note said, in the context, the department is proposing to submit those unfunded pressures totalling 140 million. Details on tab B, which is this document, as its request for additional funding in the October monitoring round. So it feels very much to me that these items were being almost slipped in. They were a bid. They were a bid up until yesterday, because that's what the committee were being asked to sign off on. And certainly, I would suggest, Julie, that given that you have admitted today as well that we haven't had the correct information in terms of its format, that we have been consistently asking for that, and that you would supply us with that written format, and that you would do that in advance of the committee meeting next week. And I would request that the department would come back here next week. I'm very mindful of timescales around this, but I would equally say the department chose this date and time to present on this issue. So I would suggest that, or request rather, that we get a detailed written update on the bids going forward in the format that is required by DFP, that clearly outlines the bids as being submitted, the cost allocation, and the impact and the request that's there in terms of priorities.
I'm happy to do so pending the conversations with the Minister. Normally you would get a briefing paper the Thursday before a Wednesday committee meeting, and the conversation will only happen with the Minister tomorrow morning. So I'm absolutely happy to return next week and to get you a paper in advance. The only issue I have is in terms of getting that paper done in time, and we'll get it to you as soon as possible before next Wednesday.
Yeah, and I respect that there's timescales and all of this, but there's equally the responsibility and requirement to get the committee to agree and sign off on the bids going forward, and that's equally an important part of your work as well. I would go as far as to suggest that we have the Minister next week as well, as it's very clear that he's now prioritising the bids going forward.
Chair, could I ask before we close, in your response to members, you talked about the meeting, the executive meeting tomorrow, I think, or Thursday. Are you expecting to have positive results in relation to the June monitoring round as tomorrow? I'm talking about the 140 million that's outstanding there on the back of tomorrow's executive meeting.
we don't know. It's obviously wrapped up in executive discussions. There has been no official paper has been released yet, so I have no basis to understand what's going on.
So it might not even be on the agenda for.
I don't know. I can't comment.
Suppose it's not fair for officials to comment on what might happen there. But I thank you for your time today. Thank you.
Okay.
Members, just in moving forward, then we had requested that the department come back to us with a written brief on the priorities going forward for the October monitoring round in the format that's required in terms of DFP guidance, which clearly outlines the bids and their priorities. And that we request that the Minister and the Department be in attendance at next week's committee to assess that. Are members in agreement with that?
Agreed.
Okay, thank you. Members, item 5 is the proposed statutory rule, Health and Personal Social Services, Health and Social Care Regulations 2014. It's on page 13 of your table papers. I'm seeking agreement to bring forward this item on to the agenda. Just want to remind members that at the meeting on the 10th of September, the committee had considered the Health and Personal Social Services Pension Scheme Regulations 2014, and we'd agreed at that point to write to the Department for further information relating to the consultation exercise carried out in relation to the proposed statutory rule. Informing members now that the Department has responded, indicated that the consultation was issued electronically to all relevant staff and was published on its website. Therefore, no costs were incurred, which was one of the questions, and it's the Department's view that the most likely reason for the nil response to the consultation was because the amendments are non-controversial, beneficial to share members and are technical in nature. So I'm asking members, are you content now for the Department to make that statutory rule?
Yeah, agreed.
Agreed.
Okay, item 6 is the draft end of session report, which is from the 1st of September to 31st of August 14. Just want to advise members that, as agreed by the Chairperson's Liaison Group, end of session reports covering the period 1st of September 2013 until 31st of August 2014 should be prepared and published on the website for all Assembly committees. Reports should provide information on all the key activities and outputs of each committee in a range of areas, including primary legislation, subordinate legislation, inquiries, budget scrutiny, policy scrutiny, and informal meetings or events, and also outline the likely key priorities for the next session. The report should also provide information on the committee expenditure for that period. So there's a draft end of session report for the Committee for Health, and it's on page 56 of the meeting folder. The section on committee membership will be amended to reflect, obviously today, the replacement of Jim Wells by Paula Bradley, so we will amend that. So asking members if you're content with the end of session report or if you wish to add or propose any amendments to it.
Looks good.
Coming enough.
Okay,
Good.
thank you. Item 7 is members' attendance, which is at page 66 of the meeting folder. Again, reminding members that the Assembly publishes the information on the attendance of members at committee meetings at the end of each Assembly session. The Central Committee Office has provided members' attendance information for the Committee for Health meetings held between the 1st of September 2013 and the 31st of August 2014. I would just asking members to check and verify their attendance record and to respond to the clerk if there are any issues by noon on Thursday the 2nd of October, indicating either that the information is accurate or highlighting if there's any error. If a response is not received, it will be assumed that the information is accurate.
Great.
Okay. Members and party whips will be advised in due course of the date on which the information will be placed on the Assembly website. Okay, item 8 is the Forward Work Programme. Just want to inform members that a revised Forward Work Programme for the period September to December 2014 is at page 68 of the meeting folder. We've had a number of discussions in and around this, so I'm asking if members are content as it stands with the Forward Work Programme.
Chair, I'm entirely content with it. I just for my own peace of mind, I remember we had some meetings around the new mental health bill that was going through, and I remember, it seemed that we were dealing with a very high pressure time frame when it came to putting it through, but yet I notice it doesn't appear anywhere in the forward work programme. Can I just maybe get from my own understanding why that is?
Well, it is listed as part of the statutory requirements in terms of the legislative requirements that the committee will be doing going forward. As it stands, I had asked last week for an update from the Bills Office in relation to that coming forward, so I'm hoping they'll get clarification in terms of timescale next week from the department, and we should be in a better position then and moving forward.
Very helpful. Thank you.
Chair, just to clarify as well, the reason that it's not listed on this committee's forward work programme is because the piece of work is going to be taken forward by a joint ad hoc committee composed of members of the Health and Justice Committee. The timetable around that is looking at the ad hoc receiving a briefing from the departments, both departments, sort of the end of November. So that is why it's not included on this work programme, but it is, myself and the Justice Clerk are fully aware of it as a piece of work coming forward.
Okay. Thank you for that, Catherine. Item 9 is matters arising, and item 8.1 on 74, page 74, is a draft motion on the committee review of waiting times for elective care. Just asking members if they're content with the motion.
Great.
And page 75 is again a draft motion on the committee's review of supported living for older people. Again, are members content with the motion?
Great.
Okay, if that's agreed, I want to advise members that the motions will be signed off by both myself and the Deputy Chairperson and will be tabled in the Business Office. The date of the debate in the plenary will be confirmed as soon as we have it in due course. Item 10 is correspondence. I want to inform members that there are 14 items of correspondence in the meeting folder and 3 items in the tabled papers. So again, in the interest of time, unless members have want to draw attention to these specific pieces, I'm going to raise a number. Item 9.1 at page 77 and 9.15 at page 3 in the tabled paper is correspondence from the Minister providing a copy of his written statement to the House and the agreed terms of reference for the evaluation of the individual funding request process. Again, members will be familiar that this was the issue that was connected in with the very emotive and emotional debate around access to cancer drugs. The Minister, in his terms of reference, has broadened out the remit, but has specifically mentioned this early access to medicine scheme. I would request agreement from the committee that we write to the department to request further information on the early access to medicine scheme, and also for an update on the Cancer Drugs Fund, which is referenced in the letter. Fergal.
Obviously, you've referred to the intensity of the debate, and that's has continued. And we know that over 14,000 people have signed a petition that will be presented soon. I think the argument is unassailable. I think the Minister was beginning to come round, the previous Minister was beginning to come round to it, and I welcome the fact that there's a review here. When Scotland did this, as a down payment, if you like, they introduced the concept of the drugs at the start of the review. And I think it would be worthwhile asking the Minister, who's very well acquainted with all of these issues. I can't say whether he's persuaded by it or not, but while the review takes place, and given the direction of travel, we might like to think would be about change, that the Minister now says, I'll open the door to cancer drugs that are available in England but not here, particularly given the PPRS scheme that exists, which would allow those drugs for free.
Okay, I think we should seek that from the Minister. I think, and I'm looking to the Clerk for advice on this, but we had requested that the Department come in on this issue. Do we have a date for it?
Chair, no, there isn't a date, but certainly can go back and secure a date.
And I think it would be useful, as Fergal has requested, that we get a sense or a view from the Minister at that point as to potential change around this process. Okay?
Great.
Members comfortable with that? Okay, members, page 143 is correspondence from the Chair of the All-Party Group on construction. It's highlighting issues in relation to the investment strategy project delivery portal. I'm seeking agreement at committee to forward the letter to the department asking that it responds directly to the all-party group on the issues raised. Members in agreement with that? Page 145 is correspondence from AGNI regarding its recommendation that the committee undertakes an inquiry into the provision of NHS continuing healthcare. I'm seeking agreement, members, and members will know that this is an important issue, to respond to AGNI advising that, just given our committee's forthcoming legislative programme, and we've made reference to the mental capacity bill and the other strategic priorities and going forward, we wouldn't have the capacity at present to undertake this inquiry. However, we will write to the department for its views on the recommendations contained within the report.
Great.
And we will share those obviously with AGNI. Thank you. Page 154 is from Stratagem PR Company regarding, as we have alluded to, the Equal Access campaign on cancer drugs. The campaign has gathered, obviously, and has been suggested a significant number of emails and indeed a petition and postcards which are addressed to the Minister for Health. And they've asked that the Minister receives these at Parliament Buildings on Tuesday, the 7th of October. The committee will be taking evidence from the department on the issues, as we mentioned, in the very near future. I'm suggesting that the committee notes the event and attends as per their availability allows. Thank you. Item 9.16 on page 7 of the tabled papers is correspondence from the Commissioner for Children and Young People regarding clause 12 of the Human Trafficking Bill. The correspondence has also been sent to the Justice Committee, which dealt with the bill, and it will be considered at its meeting today. I'm seeking agreement to note the correspondence and to remind members that any MLA can table an amendment as an individual if they so wish.
Great.
Okay. Page 12 of the table papers is correspondence from the Participation and Practice of Rights regarding the committee's stakeholder event on the 8th of October. Representatives of the Mental Health Rights Campaign would like to attend to talk about their campaign for improvements to be made to the government's Choose Well campaign. Can I seek agreement to invite the group to the stakeholder event? Okay, I'm also seeking agreement to note the remaining correspondence unless members have any comments to make.
Great.
Okay, item 11 is any other business.
Chair, could I raise the written statement that I received in the Pigeonhole this morning about the paediatric congenital cardiac
Just
services?
remind members that that statement is actually embargoed until 4 o'clock today. However, I did want to raise it. The Minister did make reference to it in question time yesterday, and therefore I think it is important that we reflect on his comments, the former Minister on his comments yesterday. He did refer to that the report was on his desk, that the report had been received, and I think it is important that we write to the Minister to ensure that the report is published and brought into the public domain. The Minister in his comments yesterday talked about a majority of the surgery taking place in Dublin. However, what does that mean for Belfast, and what support can be given? Because we had always talked about a hub and spoke model in terms of Dublin and Belfast. So I think it's critically important, and I would seek agreement that this committee would write to the Minister in light of his comments in the Assembly yesterday to ask for that report to be published ASAP so we can reflect and feed in on the recommendations contained in it. Are members comfortable with that?
Great. I mean, I hear what you say about being embargoed at 4 o'clock. We're in this room and nobody knows that we're here. Can I say that?
Well, I think you'll find that it's on the public record, Kieran. So
you don't want me to say anything?
no, I mean I think we do need to stay within the remit. The statement is embargoed until 4 o'clock. I think I've given leniency on it because there was reference made in the Assembly to it yesterday, and we can reflect on that. But we can't comment, and it would be inappropriate to comment on any detail within the statement.
You're right.
That's me.
A nice track.
Other than to say, Chair, other than to say that, you know, the Minister, in the way that he did it, provoked more questions than he did answers, and people are left in the dark now as to how these decisions have been arrived at. He's indicated clearly one particular aspect of it. There are many layers. They talked about Belfast and the role. What about those who haven't yet, or those children that wouldn't have been diagnosed pre-birth? What are we going to do there? And what are we going about the wider strategy? So there's a whole lot of questions, Nita, and that report needs to be published urgently.
Okay, thank you for that, Fergal. Thank you, members. Okay, any other business do members have? Okay, item 12 is the date, time and place of next meeting, which will be on Wednesday, the 1st of October, starting at 2 p.m. in room 29. Just advising members that in advance of the formal meeting, there will be an informal meeting to discuss the arrangements for the committee's consideration of the outcomes framework that we talked about going forward, and that will be at 1:15 in room 29, and lunch will be provided. Thank you.
Thank you very much.
Good job. There we are.
Jim, next week.